The Thurston County Board of Health is leading the county towards Phase 3 of the Safe Start Plan this week. Today, we're talking to Commissioner Tye Menser, the chair of the Board of Health, to get the details on that process and other information on Thurston County's Public Health and Social Services Department. Hi there, Tye. Thanks for joining us today.
Hey, Robert. Good to be here.
Well, the pandemic started just after you became the chair of the Board of Health. How was it for you to implement the social isolation order that drastically changed people's routines?
Well, it was an interesting transition to chair of the Board of Health. I spent a lot of time that first month just listening, reading, watching to, experts. I don't have a public health background, so there was a lot to learn about how you go about handling something like this. We had to, as a board of county commissioners who also serve as a board of health, we were balancing a lot of different priorities: public health needs versus economic needs, the immediate, impacts versus long-term impacts. One thing that was interesting was having to basically allocate resources at the same time that we were cutting. We were projecting revenue cuts to the budget. So we were working on budget cuts, and then in another meeting, we'd have this federal money allocated to COVID-19 response. So we'd be figuring out how to spend money and then how to cut money, which was a weird dynamic. We had constantly changing information, of course, just as an example, the masking, which was, there was confusion about that. Why are they telling us two different things? Well, this was an evolving situation. The amount of personal protective equipment, or PPE, supply was changing. The knowledge about how coronavirus spreads was changing. So it made it difficult to try to seem like we were giving really consistent message, but we tried to stay right on point with our health officer. And I remembered something that we heard like kind of out of the gate was, to do this right, you have to be willing to look like you overreacted. So I kind of always kept that in mind. It's like, if we're not having if we're not having the outbreak that King County or Pierce County are having, that probably means we're doing things right. So I think we've gotten good leadership at the state level too. So we've tried to stay in line there, and it's been a huge responsibility and something I've taken very seriously. I've also been impressed just finally with the adaptability of the citizens of Thurston County and Washington State, whether it's adapting to Zoom meetings like this for things that we usually do in person, whether it's community groups creating cloth masks and getting them out to different groups. It's been a great show of resiliency and care for one another. And I think the success we've had relatively in Thurston County has shown that.
That's true. Well, has the demand for social services increased during the pandemic? And if so, what's been done to meet that increased demand?
Definitely, there's been an increased demand for social services, primarily as a result of the economic impacts of the shutdown. I'll give three examples. The demands at the Thurston County Food Bank have skyrocketed, as so many people have become unemployed or furloughed. Second, I just learned this morning that we've had a 30% increase in calls for home visits through our Nurse Family Partnership Program. That's something directly run by the Thurston County, because families are in a lot of distress over various factors and looking for more support. We've seen an increased number of domestic violence calls to our sheltered, safe place, and the 24/7 crisis line. Those things have increased as a direct result of the COVID-19 pandemic. The different social service agencies have adapted. They've adapted their service models to meet the new realities, and I really appreciate the things they've done, such as Thurston County Food Bank working to maintain their services through a drive-up and walk-up events to try to maintain physical distancing. The government has responded. In Thurston County government and the Board of County Commissioners, we were given a $1 million Department of Commerce grant to address homeless services and hygiene services. Our homeless coordinator and housing department worked directly with the city of Olympia to coordinate the allocation of that money. We worked with LOT, our Clean Water Alliance, our wastewater treatment facility. They have a grant program for homeless and hygiene, which they were able to finance the construction of 2 hygiene trailers to make sure hygiene is a critical component of trying to make sure there's no outbreaks in the homeless encampments. We were able to make some adjustments to our existing grant. So to give you an example of that, we granted some money to Roof, which is a family and children's organization down in Rochester area, to run a before and after school program. Well, when schools shut down, they still had a lot of needs. It just wasn't going to be exactly in the form of an after school program. So the Board of County Commissioners, went through all those grants and made adjustments to the language to try to increase the flexibility to make sure that the money that we allocated previously could be used to meet the new demands. So those are some of the things people don't think about, but some of the work that we did. Shelter beds had to be converted, for example, in order to in order to meet physical distancing requirement of 6 feet, the setups of our shelters weren't exactly set up for that kind of distancing. So we had to do some expanding of physical facilities in order to get the same number of people, but properly distanced. We had a couple of community groups like the St. Michael's Church and Sacred Heart Church in Lacey who stepped up and provided that additional space. We had Interfaith Works in the city of Olympia worked really hard on a joint project that they've got going at 2828 Martin Way. They worked to get that open ahead of schedule and get their activities and services there adapted. So those are kind of some of the things that have been going on, and the social service agencies in our community deserve a big thanks and thumbs up from the community for their adaptability.
Challenging times.
Oh, and one other I forgot is there's some money that the county has allocated through we got something called the Coronavirus Relief Funds or CARES Act. It's kind of the same thing. It's federal money to local government for COVID-19 response related activities. And the commissioners on Friday we'd previously allocated 75,000. We added 500,000 to an allocation to the United Way and the Community Foundation of South Puget Sound, who are working together to basically identify needs among the various social service organizations and get the money allocated, kind of being our vetting for that need in the community. So I was very pleased that we were able to meet. They asked us for $500,000 additional, and we were able to meet that request out of our CARES relief funds.
Oh, that sounds great. Well, we moved into phase 2 at the end of May. How do you feel the county is doing? Are we on track for where we wanted to be right now in phase 2?
We are. There has been an uptick in cases, and we had a couple deaths. We had a couple of outbreaks in congregate care facilities, and we've had a slight uptick in our number of cases. We're at 193 total cases, 23 in the last week, 62 over the last 3 weeks. That is kind of in line with what we were seeing toward the beginning of the pandemic in Thurston County. It's still within the guidelines that makes us eligible to apply for phase 3, which is on June 17th, which is this Wednesday. And provided we don't have an unusual event between now and Wednesday, the county does intend to apply for phase 3. We qualify, provided we get the health officer's recommendation, and we believe that we will. The staff is putting together all of the data and components of the application so that we can basically apply our plan is to apply by noon on Wednesday. We know it's important to our local economy and the businesses. We think we can do that safely, provided we continue to follow the other directives that were applicable to phase 1 and 2. There are certain things that we're going to be opening up and certain things that we need to continue to stay on top of, like masking in public places where physical distancing can't be maintained, and then physical distancing, which lasts all the way through the 4 phases. There are going to be challenges to that, though. Phase 3 involves something very significant for county government and local government, which is an opening of the public face of local government. So whereas Thurston County committees and Board of County Commissioners and city councils have been meeting through Zoom or through some type of an online platform, we're going to be able to go back to having the public come into the offices and do business at, say, the auditor's office or the treasurer's office. We're going to be able to have Board of County Commissioner board meetings and public comment in person, but we're going to have a lot of procedures and things in place to make sure that we can do that safely. So that's taken a lot um, of our capacity for planning, is just getting county government properly and safely open. And one of the biggest challenges I wanted to make note of for folks is the courts,
Hmm.
because the court calendars tend to be 100 people on a docket and we have one medium large courtroom, and every other courtroom we have, including hallways in the court complex, is very small. So we're finding very creative ways to try to move court business forward while still adhering to the public health um, necessities of what phase 3 entails. So been a lot of effort going on within our court system on that piece of it, and we still have some things to put in place.
So phase 3 may happen next week, and you may have Board of County Commissioner meetings in person. You may have the auditor's office, all the county buildings open, but with these physical distance restrictions.
That's right. And businesses, for example, a lot of businesses almost all businesses will be able to be open, at least on a modified capacity. But I do believe there's an application that they need to submit about having safety procedures and a safety plan in place. So that's something that can be found online, and I can provide links for folks if they'd like to see that. But we do expect restaurants, I think, go to 75% capacity. Bars can now open, just purely a bar. Taverns were allowed to be open along with restaurants, but bars and like nightclubs now are kind of in a different category, and they're on a more limited capacity, but they can start to plan their reopening as well.
And they apply to the county for.
Uh, for those safety plans, I believe it goes through the state.
Okay.
The website is www.governor.wa.gov. We can provide guidance, but we are not the ones that are
Okay. They
doing
apply to the
approvals
state.
of the business applications.
All right. Is there's still a risk that we will go backward if outbreak increases? We'll go back to phase 2 or even back to phase 1?
That's within the purview. I mean, the county has the purview to do that, but the state has the purview to do it to us, so to
Okay.
speak. If they don't feel that that if we have an outbreak and we start there's kind of a schedule in terms of a whole bunch of data points and testing capacity and your healthcare system readiness and your quarantine and isolation capacity, your testing facilities, how you're protecting high-risk populations. If you had a major outbreaks, kind of like if you remember how this thing broke out in King County, kind of uncontrolled in a couple of long-term care facilities, I think, and I think it was hundreds, if not a couple of thousand of cases, just boom. Something like that could definitely set us backwards. So we're trying to be very careful.
Well, what can the public do to assist, to help us move forward to phase 3, then to phase 4? What are the kind of things that we can do?
It sounds like a broken record, but it's really worth repeating that just because certain economic pieces of the economy are changing and opening, the basic mandates to our individuals is not changing. So we still are beating the drum for physical distancing of 6+ feet away from other people at all times. And there is a mask directive. If you're in a public place where physical distancing cannot be maintained, and that's basically workplaces and stores is kind of the main thing. I mean, if you're out on a walk, you're not required to be masked. If you're at home, if you're working in an office by yourself, it's none of those situations. Obviously, there's exceptions if you're eating or if you have certain other work components, but in general, if you're going to be closer than 6 feet from people for whatever reason, have a cloth mask on. And if you do those two things, and if we do them religiously as a community over the next 2 phases, we will do 95% of the work toward controlling and making sure that we can open phase 3, phase 4. In theory, phase 4 could become 3 weeks after phase 3. The state hasn't released guidance on counties applying for phase 4 yet, but they did that for phase 2, and then they presented the guidance within that 3-week window. And now here we are, Thurston County, hopefully applying for phase 3 right on time, 3 weeks in. So, we can continue on that schedule if everyone really stays tight with those requirements. staying home if they're sick, avoiding others who are sick, washing hands frequently with soap and water, use hand sanitizer if you're on the go and you can't do that. Cover your coughs and sneezes. Avoid touching your eyes, nose, and mouth with unwashed hands. Disinfect surfaces and objects regularly. Those are the things we want folks to do. The main thing is to just keep on top of that all the way through this long process. And we know it's frustrating, and I'm right there with you. I've got a couple of middle schoolers at home and keeping on track of them. And you know, we're all, what I really want to see is I have a graduating eighth grader that really wants to start high school next year in person with his friends, and I want to see him do that. So I'm just really sounding like a broken record, asking people, let's do this as a community, and then we can have our kids back to school safely, and we can just move past this.
Well said. I want to thank you for taking the time. Is there anything else you'd like to add before we let you go today?
Just reminding folks that the Thurston County Public Health website is full of information, and we encourage the public to check it regularly for current information. Almost weekly, if not more than that, community letters from our county health officer, Dr. Diana Yu, links to important documents such as the business startup guidelines. That's thurstoncountywa.gov/PHSS. That's thurstoncountywa.gov/PHSS. I'm very proud of county residents for their diligence in helping us beat this by taking actions to help prevent the spread. And I really appreciate you know, their trust in us. We're working as hard as we can at Thurston County. Keep folks safe.
Excellent. All right. Thanks, Ty.
Thank you, Robert.
For daily updates, visit the Thurston County Public Health and Social Services Department website at co.thurston.wa.us/health. That's all we have for you today. Tune in next time for more updates. Again, if you have any questions or suggestions for something we should cover, send an email to rkam@tcmedia.org. Stay home, stay updated with Thurston Community Media, and stay safe, Thurston County.